Alright, guys, let's talk about what exactly happens during the procedure. Okay, this is not informed consent at all because most girls go into a clinic, they're usually in trouble. You don't know what happens from the time they're home to the time they get to the clinic, including, sex trafficking, etc. So even if she does know, she does not have a medical degree and she does not know everything that's going to happen. So this is kind of hard to stomach, but this is kind of what they do. So he talks about here basically what he does. He has a woman, get undressed from the waist down, and she lays on the table, um, and then he says, in the presence of his assistants, she's told to scoot your bottom down to the end of the table and puts her feet above her hips into the stirrups so that I can perform a bimanual exam. So he's actually looking to see the position of the cervix and the uterus and her cervix. So when he does this during the exam, he says he can tell the what health the uterus is, and then he can decide how he is going to use that clamp. Now, I had no idea a clamp would be put on me. You just don't know what you don't know, ladies. And so he talks about whether to put that on a 6 o'clock position or a 12 o'clock position, right? And then everything's sterile, that he has to use. And then he takes a flashlight to look in the opening. He says cough, and then he takes a needle to numb her cervix. I do not remember being told to cough. I think I saw in my notes there might have been a 1% of lidocaine, and I didn't even know what was going on. And then they open the cervix with a series of dilators. That's the Larminex. And then it's like a seaweed, guys, and I didn't even know that, which increases in increments. Now, picture having a baby, as I've had my 5 sons, and rather than waiting naturally for the cervix to dilate, that cervix is being forced to dilate really fast. He says here it depends on the age of the fetus or baby, and then he has to have it open, either 8 millimeters or 16 millimeters. I insert a straw, and then this is a suction tube which leads to a canister by my feet. Now, when I saw the canister, it was up on the left-hand side of me, like the level of, maybe a couch that you're sitting on, and when you look over, it's right there. I flip a switch on the canister body, which turns on the vacuum. This sounds so technical with no feelings whatsoever. He's actually getting ready to murder a child. And with a circular motion, I sweep the walls of the uterus with the tube. Within the space of a couple minutes, the products of conception are sucked through the tube into the canister. Products of conception, you mean a baby. And then the cervix closes somewhat. This is where he said the cramps are, and they are intense, guys. He said they're 4 to 5 minutes. Nah, I think they're a lot longer. I didn't have any recovery. I get to walk home. There was no recovery. When she stays in, he says, and has crackers and juice before she meets her ride home. Now, most women have a ride home because they can't drive. You can't even, you're traumatized, okay? I don't even know that women are allowed to drive home. I walked partway home. And then he takes the child, this is disgusting, back to the lab or, a lab room. He has like a strainer and washes the stuff off. of the contents, and then he puts them back in a plexiglass dish, and there he inspects what just came out of the woman's body. He says, which is a baby, but he's saying, I'm looking for the fetal sac, the gestational age, which would have been the placenta, right? And then he puts it back together, as we know if we watch like live action or stuff, to make sure that he got everything. Okay, so you have the uterine lining, and then you have the actual, he does the difference between the actual original, like, content. The organic matter is what he calls it. And he says it doesn't add up to anything that can live on its own. Well, no kidding. No kidding. When you kill a child, it's not going to live on its own. And he pats himself on the back. He says, I've done my job completely well. And there are complications sometimes, hemorrhaging, infection, or both. So this guy does a huge disservice to women. He got the Margaret Sanger Award because we know that Margaret Sanger was a racist, and Planned Parenthood is a awful place, the biggest abortion provider in the world.